Hello everyone, welcome to VMC Medical Coding. My name is Eli Rada. I am a certified trainer for medical coding and also for clinical documentation improvement. If you guys are new to this channel, please don't forget to subscribe, like and share, and also turn on that notification so I can alert you for future videos. Here is the presentation for today. Hey guys, welcome to another learning session from VMC Medical Coding. This is Eli Rada again, your medical coding instructor. Today, I'm going to talk about a very common diagnosis condition which is diabetes. I'm pretty sure that everybody knows what diabetes is. Even if you don't go to any formal medical training, you would probably have encountered this condition or this term. You probably know someone who is diabetic, or maybe a friend or a family member. This is a very common condition that doctors deal with every day, and I see this every day, guys. Every day, in my role as a clinical documentation auditor. So I review patients, hundreds of patients, every time, and I see this one of the most common diagnoses that I encounter. Now, what we're going to study today or talk about is how do you code diabetes the right way. Now, let's define diabetes first, not from my own definition, but let's go to a more trusted source. My simple definition of diabetes is someone or a person whose glucose level or blood sugar level in their system is higher than the required amount, and at some point that the doctor would diagnose that person diabetic because of the excessive amount of sugar that is circulating in the person's system. And that sugar, if I can remember it right, guys, I mean, from what I gathered, need to be matched with insulin. This is a hormone that matches the blood sugar level in our system, so that sugar would be converted into energy that we use every day, right? So that's my simple analysis or understanding of what diabetes is. But there's more, of course, there's more to it than the simple way of understanding it. Now, let's go to what this trusted source say about diabetes. According to World Health Organization, diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood glucose. Hyperglycemia, also called raised blood glucose or raised blood sugar, is a common effect of uncontrolled diabetes, and over time leads to serious damage to many of the body's systems, especially the nerves and the blood vessels. Okay, so that's your diabetes definition, guys. And I'm sure, if you're someone who's studying to become a clinician, right? You have already talked about this. You have already encountered this, and you probably have a more like comprehensive definition of diabetes. But for now, for ordinary listeners, this is what diabetes means according to World Health Organization. Now, we're not going to debate or we're not going to talk about which definition is correct or more accurate than the other. But what we're going to talk about, guys, is what is the right way to code diabetes. I get a lot of questions from different people. Like, I work for a large healthcare organization. Okay. Now, in our practice, in our operation, in our process, okay, doctors are are expected to document conditions, not just diabetes, all conditions, the right way, so that we as auditors, as coders, will be able to capture the correct the correct code, and we'll be able to translate that language into the appropriate code for that condition. Now, that's the expectation for the doctors. Now, some doctors, of course, they're not trained to become medical coders. They don't have an idea how to put the correct language. Although of course, they're clinically trained, but some languages that doctors use sometimes do not automatically convert into a code that will be acceptable to the payer. So let's put it that way. And some doctors, when we come back to them and ask them to, hey doctor, could you please consider this, or what do you think of this language? And some doctors appreciate it. Some doctors are a little bit hesitant to some suggestions, because they wanted to, of course, to use their own language, as they were trained in the medical school. But what I'm trying to say here, guys, is if you are someone who's learning medical coding, and also a clinician who's interested to know how coders think, this is this is how we do, or how we code diabetes. To give you just an idea, guys, so how diabetes are coded, and what are those nuances in coding diabetes. Okay, so we have the definition, we got that covered. Now, let me tell you guys that there are actually several types of diabetes according to the coding language. Okay, maybe not just coding language, but I'm trying to say is that from what have been studied from the past, they came up with all these types of diabetes. But we only know probably a few, a couple of types. But according to this study that have been done before, these are the different types of diabetes. Okay, type 1. This is a juvenile or pre-puberty diabetes, which is coded to E10.9. This is the unspecified diabetes, guys. Okay. Now, the other one, the next one is type 2, which is the adult onset. The unspecified code for that is E11.9. Now, I am saying here, guys, unspecified code, because diabetes have many codes, and we'll get into that, guys, later in our discussion here. Now, there's also what we call secondary diabetes, and secondary diabetes, guys, is breakdown into 3 categories. Okay, so diabetes due to drugs, and the code without complication is E09.9. Example for that diabetes due to drugs would be someone who is taking, or someone is subjected to long-term use of steroids. And I see this a lot, guys. When I review clinical documentations, and the patient is subjected to long-term use of steroids, chances are this person will become diabetic in the long run. So that's one example. Now, another type of diabetes, or secondary diabetes, is diabetes due to underlying conditions. And of course, the code without complication is E08.9. So you see, guys, as the type changes, your category code, or your code for diabetes, also changes. Now, the last one that I would like to share with you guys, secondary diabetes, is diabetes due to a specified condition without a complication, and that code is E13.9. An example of that is someone who just had, or whose pancreas had been surgically removed. This is what we call post-pancreatectomy. Now, let me go back a little bit, or back up a little bit here. The diabetes due to underlying condition. Another example for that is a person who has a Cushing's syndrome. And from what I understand, guys, Cushing's syndrome is a disorder of the hormone which is called cortisol. So someone who is or who has an excessive amount of that cortical hormone. Okay. Now, again, guys, these are the different types of diabetes, and the codes that I gave you so far are the codes for unspecified codes for these different types of diabetes. Now, the reason why I call it unspecified, because diabetes, if mixed, or if combined with a complication, or if combined with another condition, guys, your code changes. And I will show you that in a little bit. Okay. Now let's go to the default diabetes type. Okay, I have already talked about the different types of diabetes, right? The type 1, type 2, and also the secondary diabetes. Now, if the doctor does not specify the type of diabetes, now question is, what type do you guys code, or what type do you guys document? Okay, according to the coding guidelines, the type of diabetes, the default type is this. Okay, let's read. If the type of diabetes mellitus is not documented in the medical record, the default is E11. And what is E11, guys? If you go back here, this one right here, that's E11.9. So what is the E11.9? It is the adult onset type 2 diabetes. Now, so look here, guys. Adult onset diabetes unspecified code is E11.9, which we have already established. If the doctor documents IDDM, what does IDDM mean? Insulin-dependent diabetes mellitus. Okay. Now, that's also an unspecified type of diabetes. Now, people come up to me, should we not consider, IDDM or insulin-dependent diabetes mellitus as type 1? Now, the reason why people ask that question is that because type 1 diabetes, guys, these are the people like what we have already seen in the earlier presentation, earlier slide, that type 1 diabetes, as these are the people who have who had diabetes since since they were little, since they were very, very young, pre-puberty, or maybe a patient who's born with a damaged pancreas, right? So these are the type 1 diabetes. Now, these type 1 diabetes, guys, are automatically insulin dependent. Yes, they're automatically insulin dependent. And when you say IDDM, there is this notion, right, that it should be type 1. But the coding guidelines say otherwise. The IDDM is still considered as type 2 diabetes, because even a type 2 diabetes can be insulin dependent. I hope you guys understand what the difference between the type 1 and type 2 in terms of the use of insulin. Again, let me repeat. Type 1 diabetic patients are automatically insulin dependent. So there's no actually use of the code for insulin, which we will discuss also in a little bit, for the type 1 diabetes, because they are automatically assumed that they are insulin dependent. But if the doctor documents IDDM, again, the IDDM here, okay, insulin-dependent diabetes mellitus, it does not necessarily mean this is type 1. This is still considered as type 2 according to the coding guidelines. And what the code that you guys are going to use, of course, is the code for the type 2 diabetes. I hope that's clear, guys. Now, let's continue here. NIDDM, non-insulin-dependent diabetes mellitus, is also considered as type 2. And of course, the unspecified diabetes without the doctor specifying as to the type of diabetes, you always consider that as what we call this one right here, this type 2 right here. Okay, so let's move on to the next slide here. I would like to talk to you about, guys, the diabetes link rule. Let me read. This narrative here was taken from the coding guidelines, straight from the coding guidelines. Let's read. The word with or in should be interpreted to mean associated with or due to when it appears in a code title. The alphabetic index, either under a main term or subterm, or an instructional note in the tabular list. The classification presumes a causal relationship between the two conditions linked by these terms in the alphabetic index or tabular list. These conditions should be coded as related even in the absence of provider documentation explicitly linking them. Okay, so it's a lot of words, guys. Kind of like a lot of narrative here, but let me explain what it means. Okay, so diabetes link rule. Diabetes, guys, is a condition, and every clinician knows this, that affects other body systems. Okay, it affects the nervous system, it affects the circulatory system, it affects the skin integrity. So this is something, guys. This is a diagnosis that when a person gets this, or gets diagnosed with diabetes, it has to be treated, it has to be controlled, because if it doesn't, then it will most likely affect other systems, like I have already mentioned: nervous, circulatory, the skin integrity, and also the renal system. It affects the kidneys. So according to the coding guidelines, guys, okay, if diabetes if a diabetic person also has those other conditions that are considered complications to diabetes, there is an automatic say association between these two. So what I'm trying to say here is that when you're reviewing, we're seeing in the documentation, okay, if you're a doctor and you put the patient is diabetic, and at the same time patient also has chronic kidney disease, the code that is applicable to that situation, even if you don't link them in your in your statement that diabetes and renal disease are connected to each other, the code that applies there is already a diabetes that has a complication. It's no longer the unspecified. You guys remember the unspecified code here? This one right here, the E119. You no longer use this, or this code is no longer applicable because of that complication attached to diabetes. That's what I mean about the diabetes link rule. The guidelines said if you are the coder, okay, if you're the coder, you don't need to look for any statement from the doctor saying that the diabetes and the chronic kidney disease are associated with each other. You automatically use a combination code. It's not the E11.9 anymore, because there is a combination code specific to that diabetic complication, which is diabetic chronic kidney disease. Another example is a patient is suffering from peripheral neuropathy. This is a patient is experiencing neuropathic pain in the leg, or numbness, or some tingling, and patient is also diabetic. The doctor does not need to link these two together in order for the coder to capture the combination code. You automatically assume that diabetes and peripheral neuropathy are two conditions that are connected or associated with each other. So again, what is the application? You no longer use the code, the E11.9 right here, because this unspecified is E11.9, right? Now, to just give an example, if patient has IDDM and also polyneuropathy, this is the peripheral neuropathy that I gave you guys, okay? you no longer apply this code right here, but rather you are now assigning the code, a combination code that captures the diabetes and also the polyneuropathy. And this is the combination code that I'm referring to. So that is what this diabetic rule means. Okay. Another example, the one that I gave you guys earlier is IDDM, right? Or diabetes unspecified. Remember, the default type of diabetes is type 2. So you always have the E11.9 or E11 as a category code. But if a person also has a CKD, okay, also has a CKD, you don't need this code, but you need a code that captures the diabetes and also the CKD, and the code for that is E1122. You see, guys, where I'm going? This is the reason why, some people are claiming that, hey, coding is easy. I'm just going to Google it. No, there is actually there is a correct way to do it. Not just Google it. You need to understand the coding guidelines, how to apply the correct diabetes code. Okay. Now let's go back here. It says here, and the key language here that I'd like you to pay attention to or look at is this language here. Okay, that says this conditions should be coded as related even in the absence of provider documentation explicitly linking them. Okay. I hope this is as clear as a day to you, ladies and gentlemen. Now, what are those different conditions that have a direct relationship to diabetes? Let me show you the next slide, guys. This is the next slide right here. So conditions with automatic linkage to DM or diabetes. Look here, guys. Chronic kidney disease. Your combination code is E1122. Diabetic foot ulcer. Again, if a patient has diabetes and also having some skin integrity disorder, has a foot ulcer, the code is E11621. Diabetic peripheral neuropathy, the one that I gave you, the example that I have on the board earlier, code is E1142. If a patient has diabetes and also has PVD or peripheral arterial disease, the combination code is E1151. Patient is diabetic, also has a cataract. The doctor does not need to link the diabetes and cataract. The combination code is E1136. So you see, guys, these are the different ways how to code diabetes. This is the reason why if you go look for diabetes code, guys, in Google, you will most likely get a lot of codes, okay? A lot of codes because they're all diabetic codes. They are all diabetic codes. Even the secondary diabetes, Google will give you that, the E09, the E08, the E13. Now, people who don't study, who did not learn medical coding, guys, will easily pick up those secondary diabetes codes, not knowing that those secondary diabetes codes have specific rule or have specific applications. Again, guys, the default code for diabetes or the default type of diabetes is always type 2, even if the doctor does not indicate that this person has a type 2 diabetes. You always pick it up as diabetes type 2 or the adult onset diabetes. Okay, now let's go to the next slide. Let's see what the next slides say here. There is what we call a diabetes drug rule. Okay, what is this diabetes drug rule? Let's read. Additional code or code should be assigned from category Z79 to identify the long-term current use of insulin, oral hypoglycemic drugs, or injectable non-insulin anti-diabetic as follows. For the insulin, this is the code Z79.4. For the oral hypoglycemic drugs, this is the code Z79.84. And for the long-term current use of injectable non-insulin is Z79.85. And guys, this is a hard rule. What I mean by hard rule is that this got to be followed. Okay, diabetes, guys. Assigning the diabetes code, guys, is one thing, but if you read the coding book, there are additional rules that you guys need to follow as well. Now, what are these rules? This is one of those rules. If patient is on insulin, you automatically assign the code Z79.4 as an additional diagnosis, as an additional code. Now, if a patient is taking oral hypoglycemic drugs like metformin, what else? There are many of them, guys, out there in the market. What is the code? The Z79.84. And another one is use of injectable non-insulin. I think this is, correct me if I'm wrong, it's probably one of those new drugs out there, Ozempic. What else? I cannot remember on top of my head what are those, but the key takeaway here is if the person or if the patient is also taking these drugs and the diabetic drugs, you have to assign the code for those drugs as well. Okay. Now, let me show you guys something interesting. If you have seen a coding book, okay, this is also related to diabetes. If you have seen a coding book, I'd like to highlight or emphasize these process or the correct way of how to read your coding book. Now, of course, this is related to diabetes. Look here, guys. Diabetes coding conventions. Coding conventions, guys, does not mean assembly of people, having a conference or convention. It doesn't mean like that. Coding conventions are a set of rules, coding rules that every clinician, every coder needs to follow. Okay. Now, look here, guys. Remember the type 2 diabetes? It starts with the E11. Now, this E11 is what we call a category code. E11, guys, or the first 3 characters, E11 here, is a category code for the type 2 diabetes. Okay, so remember that. A category code is the first 3 characters. Now, the other characters after the first 3, we call them, if it's attached to the first 3, we call them subcategory. Now, look here. You see this includes, this is a coding convention. Look here, use additional code is also a coding convention. Excludes one is also a coding convention. What these coding conventions mean, guys, these are strict coding instructions or additional instructional note that every coder needs to pay attention to. Okay, and look, you see this Z79.4? You guys remember that? Where did you see this? You see it right here. Additional code should be assigned from category Z79 to identify the long-term use of insulin. And in the coding convention, this is an official coding book. If you go to this page where it says diabetes type 2, you will see all these coding conventions. And look at the coding convention here. It includes the use of the additional code for Z79.4 if patient is insulin dependent Oral anti-diabetic drug, Z79.84. This is the oral hypoglycemic, and also the anti-diabetic drugs. You have these codes, guys, alongside your diabetes codes. How does that apply? Let's say, for instance, let's go to the board for now. Let's say, for instance, the doctor said 48-year-old male who is IDDM, has polyneuropathy. Okay, so you have this scenario here, a 48-year-old patient, diabetic, IDDM, insulin dependent, and at the same time has polyneuropathy. Remember the rule? You have to connect this, right, in order for you to use the combination code. You don't use the E11.9, which is the unspecified diabetes code, but rather you are to use the combination code, which I showed you guys earlier. Look, this is your polyneuropathy or peripheral neuropathy. What's the code? E1142. Now, let's apply that, E1142. Okay, that's your first diagnosis code. And what does the coding convention, follow-up instruction? Let's go back here. What does it say? What is the drug rule? Additional code should be assigned from category Z79. And if we're talking about a long-term use of insulin, Z79.4. In that case, we are to assign also Z79.4. This is your secondary diagnosis code. This is your DM or IDDM. This is your insulin. So I hope, guys, this is as clear as a day. If you have any questions, don't hesitate to leave me a comment, okay? Message me and I will respond to your question the soonest possible time. That is, the best I can. Okay? Now, now that you have there, that's the basic diabetes rules, guys. The basic diabetes coding application. There are more to learn about diabetes coding, but in the meantime, guys, this is the fundamental, this is the basic rule that you guys need to understand. Okay, let me do a little bit of recap. Diabetes have many types. Okay, type 1, which is juvenile diabetes. A person has this when she or he was very, very young. Okay, number 2, type 2 diabetes, which is adult onset diabetes after the patient had past a puberty age. If this person develops diabetes, it is considered as type 2 diabetes. Secondary diabetes, there are diabetes that are called drug-induced diabetes. Okay, there is a diabetes that is because of an underlying condition, like the Cushing syndrome that we have on the presentation earlier. And the last one is the diabetes post-pancreatectomy. Patient has his or her pancreas removed, and that made a person diabetic. Okay. Now, another key takeaway is if a person has another condition, remember the diabetic rule, another condition that is associated to diabetes, you no longer use the unspecified code for diabetes, but you are going to use, like this one right here, the combination code is applicable to the diabetes in that condition that has association to the diabetes. Okay. Now, also, another main takeaway here is that don't ignore the coding conventions. You always look at the coding convention because they are important. Okay, so those code also, use additional code, code first. There are many of them, guys, and that's another topic for another day. I will, one of my lectures will be focused on the coding conventions, the coding rules, the general coding guidelines, and I have plenty of them to share with you. Okay, so that's it, guys, for today's diabetes lecture. And I hope you guys have learned something new, and I hope you guys continue to follow these, this channel, because we're going to share with you more information, tons of information for coding. Okay, till next time, stay safe, guys, and I'll see you again. Thank you guys for watching the full video. If you have any questions or comments, please feel free to leave me a message at the comment box and I will respond to your question as soon as I can. And if you want to know more about our coding program, where countless of people have already learned medical coding and gotten certified, please feel free to visit our website at vmcila.com, or you can email us at info@vmcila.com. You can also text me at 818-642-4975. Thank you, stay safe, and I'll see you next time.